The following segment is sponsored by Moda Health.
Welcome back to AM Northwest. A quarter of all Oregonians either have diabetes or at risk of developing the disease. Here to share what that means for the holidays, we welcome Senior Vice President of Moda Health and former Chair of the American Diabetes Association, Robin Richardson. Good morning, Robin.
Good morning, Helen, and happy holidays.
Happy holidays to you too. What does that mean? Like, we talked about a quarter of all Oregonians. About how many people is that, you think?
Yeah, nationally, over 34 million individuals have diabetes. In Oregon specifically, it's over 300,000, with another 100,000 who have diabetes but aren't aware of it. And then we have 1.1 million individuals in Oregon living with prediabetes.
Wow. Well, what should the folks with diabetes be thinking about as we go into the holidays? Because in the holidays, it means we're eating more, we're drinking more, and then add COVID on top of it, and we're eating more and we're drinking more.
Yeah. If you're over the holidays, it's most important that people remember what they were doing the rest of the year prior to the holidays to manage their disease. So things like taking your medications, eating healthy, managing your stress, getting regular exercise. Now, the holidays this year occur during a pandemic, so it's even more important that people take extra precautions regarding COVID-19, because people living with diabetes are more susceptible to getting COVID-19 and to the impact of that disease on them. And for example, the American Diabetes Association just compiled some statistics that showed that 40% of all U.S. COVID-19 cases, people had diabetes, versus 10% of the general population is affected by it. So it's really important that people are able to maintain to take COVID precautions, so maintain social distancing. If you have a small family gathering, wear your masks, wash your hands, take all the other precautions.
What if you have a family member who has diabetes and you're hosting a small dinner, as you mentioned? What should you think about? And then and also some ideas for presents when you're thinking about that as well.
Yeah. So if you're hosting a small family gathering, I think the most important things to remember are, one, don't be the food police, but offer healthy options, offer low carbohydrate options. And if your tradition is to send food gifts or candy or things to family members, think about sending fruit instead of maybe fruit cakes. Think about sending grocery gift cards or restaurant gift cards where the individuals can still enjoy the intent that you had and appreciate the intent, but make their own healthy food choices.
Those are good ideas. How can you tell, what are the symptoms of diabetes if you're an adult and you have no clue, maybe worried you might have it?
Yeah, the symptoms can vary, but one of the key is extreme thirst, weight loss. And if you think you have it, the most important thing is to see your physician. There's no such thing as a touch of diabetes. You either have it or you don't. And the earlier that you can detect it and start managing it, the better that you can avoid the serious effects that it has on the body, because diabetes is a leading cause of stroke, of heart disease, of kidney failure, of all kinds of other serious consequences. So if you think you have it, just see your doctor and get tested.
Do the same rules apply for people who have been diagnosed as pre-diabetic?
Yes. In fact, if you've been diagnosed as pre-diabetic, it's even more important to keep in touch with your physician, because they've already tested you and you're on the edge with your lab results. And so it's very important to keep in touch, have regular visits with your physician.
And where do you suggest people with diabetes go for help?
There's a couple of great resources. Well, first is the American Diabetes Association. 1-800-DIABETES is their number. Diabetes.org is their website address. They have a lot of information available. But health insurers like Moda have lots of resources, lots of materials, lots of programs for individuals with diabetes. For example, at Moda, if you are a member and you have diabetes and you have our dental plan, you're eligible for extra teeth cleanings, because there's a direct correlation between oral bacteria and the ability to manage your disease. We also recently established a partnership with a company called Livongo that offers Moda members who have diabetes cellularly connected blood glucose monitors, testing supplies, and access to diabetes health coaches at no cost to the member.
Wow. Robin, thank you so much.
Thank you.
If you'd like to find out more, you can contact Moda Health or go to modahealthminute.com.